As we all know, the bacteria is the main cause of periapical lesions. Which part of endodontic treatment is, in your opinion, the most important part? Well, I think that, of course, shaping is very important, but irrigation is the key to success. And when we talk about irrigation, we always need to mention about agitation of the fluid. What kind of agitations we can use? Well, let's discuss about heating in this short tutorial. During irrigation, we can use a lot of techniques in order to agitate the fluid. What is the agitation? It's all about the movement. To activate the fluid, you can use, of course, ultrasonics as well as sonic devices. But we also know that during irrigation, we need to follow the rule volume in time. Is there an option to enhance the working ability of the fluid? Well, in fact, it is. It's about heating the hypochlorite. We all know that preheated hypochlorite can have a better ability to dissolve pulp tissue and clean the canal. But when we talk about heating, we can discuss about two different options. From one side, you can heat the hypochlorite inside the syringe. But of course, from the other side, you can heat the hypochlorite just in the canal space. Which option is better? Well, let's find out. Let's go and check the literature. But you know what? Let's talk with one of the authors. Let's discuss with Dr. Iandolo about this specific subject. Alfredo, it's nice to have you here. Can you tell us something about this research?
I am Professor Alfredo Iandolo from Italy. I am a specialist in endodontics. I am an active member of Italian Endodontic Society and a certified member of European Endodontic Society. And I am the founder of a social group 3D Cleaning Project. To heat the sodium hypochlorite, the internal heating technique, it's very important because we can have powerful pulp tissue dissolution, we can have powerful bacteria removal, we can have a low viscosity of the irrigant. So we'll have a deeper penetration of the sodium hypochlorite inside the lateral anatomies. The correct temperature of internal heating is between 80-90 degrees because at boiling point we can have 200 times faster pulp tissue dissolution. To have this temperature, we have to use special devices that can control the temperature. To heat the sodium hypochlorite, we can use devices like System B or similar. But it's very important to use heat carrier, small heat carrier, that can reach at least 3-5 millimeters away from the working leg. It's very important to reach at least 3-5 millimeters away from the working leg with the heat carrier, because the more we insert the heat carrier inside the root canal, the more this technique is powerful in the apical third. Best protocol for a good 3D cleaning is when we associate the internal heating with ultrasonic or sonic activation. In our last research published on Australian Endodontic Journal a few months ago, we saw that with this technique in roots shaped in a conservative way, we had really nice results. So beautiful debris removal, deeper penetration of the irrigants. So really this technique, with this technique, this easy technique, we can have really nice results. Another thing important, and few months this new research will be published. We developed a new technique to perform 3D cleaning, so internal heating plus ultrasonic activation in teeth with an open apex without the risk of irrigant extrusion. Few months and this new research will be published.
Okay, now let's see the clinical movie. As you can see from the movie you've just watched, the isthmus after heating of the hypochlorite became clean. Of course, in clinical scenarios we are using and we should use different possibilities to activate the fluid. What is the conclusion? Well, the best is to use two different techniques. You can combine heating and sonic or ultrasonic activation. This will give you more benefits. Cleaner endodontic space will give you better obturation. I hope that this short tutorial gave you some clinical tips to be used just the next day in your office. Thanks for watching, and don't forget to subscribe to our channel and to turn on reminder to see new movies that are coming out. If you want us to record any other movies with different subjects, please do so and write it in the comment. My name is Gregory Witkowski and thank you for watching. See you next time.